Saligram. I'm the founder of Arogya World. We are a global health organization that does non-communicable disease, NCD prevention in India. We work on science-based population level prevention programs. Across all our programs, we have educated 5 million people to date. We're 10 years old this year. And we follow a model that takes prevention to people right where they live and learn and work. We believe in the World Health Organization evidence that 80% of heart disease and 80% of diabetes, for example, can be prevented with 3 lifestyle changes. You eat right, you exercise, and you avoid tobacco. So that's at the core of all our work. And these days, mental health is also included under non-communicable diseases by the World Health Organization. So through my work at Arogya, in addition to NCDs, I have had a front row seat in global health and have watched many waves, including HIV and maternal health and women's health issues and under 5 childhood mortality and malnutrition in all its forms. But COVID-19 is unprecedented in that it has affected all aspects of the way we live and learn and work, and has exposed so many cracks and fissures in the way society is constructed. So we will be unpacking a lot of NCD related COVID-19 impact with this curated set of webinars. And starting from today, where we'll be looking at the mental health fallout from COVID. So speaking to us about that is Garen Staglin. Garen is the founder of the Staglin Family Vineyards. He's a winery owner. He's a entrepreneur and a venture capitalist, and he is a brain health philanthropist. He and his family have mobilized all of Napa Valley to rally around brain health, and they have this massive science and wine and music festival every year. It's really amazing to see what the family has done. They've raised more than $400 million to invest in brain health research. So hats off to you, Garen. I have learned so much from you, including that mental health is better framed as brain health, and that it is possible really to mobilize CEOs from around the world to confront and then invest in mental health. So we're proud, Arogya World is proud to be a partner of One Mind at Work, and we are really fortunate to have you today. So if you would like to address us with your opening remarks, and then we'll open it up to Q&A. Over to you, Karen.
Thank you, Nalini. It's my honor to be here and address you and your colleagues. Let me start by saying this is a bit of a mutual admiration society. You were very kind to talk about our work, but let me tip my hat back to you, and your work at Arogya World is just amazing, and your tenacity and your dedication and the work that you've done with very large corporations throughout India is really noble and exciting, and it's our pleasure to be your partner, and we've been learning from you also, and your approach to wellness in its entirety is not only saluted, but absolutely necessary, and even more so in today's time. So it's my honor to be able to be here with you and with your colleagues on this Zoom world. Now, we've gone from being baby boomers to baby zoomers, right? I spend something like 6 to 8 hours a day in video conferences. I used to spend 50% of my time on airplanes. That's not the case anymore, but I think it's different, but I'm probably more productive and getting more done because we're not wasting time moving from place to place. We're just getting things done in one place. But talking about getting things done, let me set the stage for all of you as to why this is so important to me. The picture you have in front of you here is my family. Um, and we're all smiling, but in 1990, we weren't all smiling because Brandon, my son, the gentleman in the pink shirt there, during that year had a psychotic break. He was between his freshman and sophomore year at Dartmouth College. And out of the blue, at least we thought it was out of the blue, knowing what we know now, we would have seen more of the symptoms coming. Um, he basically described to us he thought somebody took half his brain away and he didn't want anybody else to put it back. He was suicidal. He is having, massive hallucinatory thoughts. And like so many people with these illnesses, it's at that very moment and moments after that where they believe that if this is as good as life is, it's not worth living. We were fortunate that we had enough resources and contacts that we could get a credible diagnosis. Who would thought that we were relieved to know that he had schizophrenia, but at least we knew what the problem was, and we knew what we could try to mobilize resources, doctors, and therapies to try to help him. So we did that, and within a period of about 6 months, he was functional enough, I wouldn't say he was well, to be able to go back to Dartmouth College. And during that time, he actually was able to function so highly that he graduated on time with honors in a dual major. That's a testimony to Brandon and his tenacity, will, and intellect. He today, if you fast forward, he is married for the last 11 years to a wonderful lady, Nancy. He's got a wonderful dog, Cooper. He's got a bunny, lives in a beautiful home, and he's president of our nonprofit, One Mind. So his is clearly a story of tragedy to triumph. But for so many people, 400 plus million people around the world, or maybe larger, that often is not the case. So we, 26 years ago, said we have two choices here. We can run away from this problem, just not talk about it. Brandon's okay now, we don't have to deal with it. But we said that's not the right thing to do. We decided we would dedicate ourselves and run towards the problem. So during that time, we've focused on the mission statement that you see in front of you: accelerate discoveries in brain health through large-scale open science research projects. We have them in early intervention and prevention in schizophrenia. We have them in post-traumatic stress. We have them in traumatic brain injury. We're a part now of a global consortium in biomarkers for psychosis. We're participating in a 100,000 person study in depression. So a variety of things, and we funded 35 rising star scientists, kind of like seed venture capitalists, trying to find breakthroughs, and then we help them nurture them on into scientific discovery and ultimately translational outcomes. But several years ago, we decided to add to this very ambitious mission around science to bring society into that. And bringing society into it had twofold. One, trying to address the very real issue of the lack of knowledge and information that had to do with what was these illnesses. And so we launched a whole anti-stigma and discrimination campaign. I won't say a lot about that, but we're very pleased that Ken Burns, the noted documentarian, is working on a 10-year, 3 major film project with us, which we are producing. And the first film will be out in the spring of 2022 through 350 stations throughout the United States, and ultimately displayed around the world. But 4 years ago, we decided we needed to address the workplace, because the workplace is where we used to spend 70% of our waking hours in the office. Now we're spending 70% of our hours, but we're not in the office. We're doing our work from home. But eventually there will be a back to work mentality, and that's going to bring these areas into real focus. But if we just look at these numbers, and these are the US only, we know that in your lifetime, 1 in 3 people will experience a mental disorder. That's personally. But I want everybody on this call to know that everybody has somebody. Everybody has somebody that at some point in time has the illnesses, from the early illnesses of autism to eating disorders, to reading disorders, to anxiety, to depression, the #1 cause of adult disability in the world, to the illness that my son has, schizophrenia. We have bipolar illness. And now we have these late life disorders of dementia, Parkinson's, Alzheimer's. So there isn't anybody that doesn't have a friend, a family member, a co-worker, a neighbor, or somebody that they know. So we need to eliminate this idea that the normal includes people without these illnesses. No, the normal is everybody knows somebody with these illnesses, and we need to be open in addressing them. And we'll talk more about that as part of our work. These other facts show you other things, but the 24 billion is lost productivity. We know that the care workers, and this is before COVID, are spending their time caring with a loved one. And we know that parents go to work knowing that parents with children with eating disorders and anxiety, they're just as worried at work as they are at home about the safety and security of them. So they can't leave it at home when they come to work. It's still with them each and every day. So it's impossible to ignore it. Running towards it is important. One more slide, which Katie is going to bring up here, which is the impact that COVID-19 is going to have on all of us. And this is don't pay so much attention to the exact metrics, but the graph demonstrates, I think, the point that the first wave of mortality and morbidity of COVID-19, we are now near the peak. Some countries are already on the back side. You see it coming down. We expect, we don't know for sure, but there may be a second wave when we get to the fall of influenza-like illnesses, and it may rear its head again. And then we're going to have ICU recovery, and then there may other chronic disorders. But it's the turquoise line I want you to look at, which is the line of increased psychological trauma. One of your colleagues on the phone said we need to address that. Clearly, we need to address it, because increased illness, increased economic energy, burnout is creating an entire new stress syndrome, which is creating this dotted line, which is people who never before suffered from these illnesses, and they are now going to be victims of the COVID-related anxiety and depression, and it will last far longer, and as you can see from the amplitude here, go over a much longer period of time. So we at One Mind, through both One Mind at Work and through our evidence-based research in One Mind proper, we're trying to address this problem on multiple fronts, and I'm really pleased to be able to share our work with you and answer your questions as we talk through this very important issue today. So I'll turn it back to you, Nalini.
Thank you, thank you. So lots of questions from all of us about this topic. If we could just look at that slide one more time, Katie.
Yeah.
So what would be the timing roughly, Garen, of the onset of this huge mental health wave? Both of people who are suffering from mental illness, and people who have never had any history of it and who are now just experiencing heightened anxiety during COVID.
It's happening right now, Nalini. I don't think that anyone today feels the same way that they felt about people around them, their fears and phobia when someone sneezes, when someone's coughing. in any kind of close proximity. I mean, you just see the tension and anxiety when people know they're supposed to be wearing masks and aren't, and somehow that's perceived now as a civil liberty that you don't have to wear a mask, when in fact it's not you that's the liberty you're abusing, it's the liberty of others to be protected from the illness you may give them. So I don't think there is an onset like the first case of COVID, which I think we're still tracing back and may not have back to that animal location in Wuhan. It's going on right now. Everyone is experiencing it. New people are feeling it. So it's here, it's with us, it's right now. How much bigger it's going to get and how long it goes is going to have a lot to do with what employers are doing to address it, and why we as a society, a global society, need to address this with much higher intensity. If I put this to you in economic terms, it ignores the impact on people, but sometimes economics are a way we motivate action. Today, almost every country in the world has the burden of these illnesses in terms of productivity, the actual healthcare costs, the comorbidity of these illnesses is about 4 to 5% of the gross domestic product of most countries. Yet most countries spend less than 0.5% in addressing this issue. They spend far more money on dealing with research in heart disease, dealing in research in diabetes, dealing with research in cancer. But brain health has been the stepchild of major chronic illnesses. If there's anything that's good about this illness, it is that we are now seeing this increased awareness, and this curve is now being much better understood. And I think that the deployment of significant increases in governmental resources to address this problem is our hope, our ambition, and we're working on a major project called the Healthy Brains Global Initiative, which I'll come to later in this conversation to try to address it. But the time is now, Nalini. It's not something we're going to look forward to in 6 months. It's happening.
Right, right. So a couple more related questions, and then we'll open up there's a lot of questions already on the chat box. So, but the question I would like to better understand is the first one that came up in the informal conversation before we started, and that is, why is it that people are experiencing so much stress and increased anxiety at this time? Is it uncertainty about jobs, about the future? Is it because we don't know when things will become normal again? Is it fear? Is it loneliness? You know, I wanted to see if you could comment on that.
Well, I think the answer is it's all of those things. Every person's situation is different. But one thing is not different, Nalini, is that these illnesses, brain health and brain illness, does not know any geographic boundary. It doesn't know any economic boundary or illness. It strikes everyone globally. I mean, we do have differences in culture, which may make it even more difficult to admit their weaknesses, the issues of faith in Asian countries, machismo in other countries. But we have to, as a society, recognize that everyone is going to be impacted by this, and everyone going to need help. So the words like empathy, and the words like awareness, and the words like making better use of resources we already have available, and better understanding, and eliminating the fear that just because someone has severe depression or should be criticized because they can't get out of bed, they're feeling so bad. We've got to get over that. We're all on a spectrum of brain health. So how I like to think about it. We all have good days and bad days. Today, there are going to be more people with bad days than there were when we entered 2020 at the height of many economies. Today, we have people who don't know what the world is going to be like in the future, whether they will have a job, whether their businesses are going to continue to exist. You know, we have this fight or flight syndrome controlled by the amygdala in our uh, brain systems, and we have very complex chemicals, serotonin, dopamine, glutamate, and all of the balance of those chemicals are affected by stress and cause us to have different reactions at different times. But our systems are in real stress right now, and our brain health is suffering as a result.
So I the big question I have is, how can the U.S. Prepare for this mental health surge? Nobody's talking about it. Occasionally there's an article, but really there are no White House briefings on this. The physical crisis, may come and go. We may have a new world order. We may have a vaccine soon, and all of that is great. But what can the US do to prepare? And when it's a US, it's also the rest of the world, really. The lessons can be learned. What can a country do to prepare for this mental health surge?
Well, there's a lot of things we can do. I'm not sure there's a lot of things we're actually going to do, but let me tell you about the things that I know that we are doing and the employers that we are working with are doing. So first, I will tell you that as a combined entity of the advocacy groups in the United States, we have several, and NAMI is one that you may know of. Mental Health America, you may know about. There are the Center for Behavioral Health. There's about 12 organizations that have come together, and as a part of the stimulus plan that is being put forward, like the PPP programs and others, we have a package that we're putting forward for Congress to address in what we hope this third wave of about $40 billion worth of new incentivizations, removal of restrictions, and the mobilization of incremental telehealth services. I think all of your listeners here will know that the availability of psychiatric support is in very short supply. We don't have enough trained physicians in this field. You have to wait 6 months many times to get an appointment to deal with your depression. That's not acceptable. So telehealth has become an important way for people to get services earlier, but there's been a restriction on how telehealth service can qualify and whether they were reimbursable. Many of those restrictions have been lifted. We're trying to get them permanently lifted so that more people can access them. Katie's going to talk about in a minute something that we've been doing for many years, which is now going to be specifically curated for this, and that is about 20 years ago when Brandon had a relapse and was now recovering again, we began a whole series of investments in what are called neuroplasticity advantaged computer-based programs. So what is neuroplasticity? Neuroplasticity is the fact that all of us on this call right now are actually generating new neural pathways. Our brain is this wonderful regenerative organ, and these new neural pathways help us restore our brain health. Well, we've now learned over this 20 years that through positive feedback loop computer-based systems, we can use this neuroplasticity to help our brains cope with cognitive and mood disorders by reinforcing coping mechanisms and regulating mechanisms. There are over 900 of these apps that are out there now. But the FDA does not regulate these, so there is no way in which you as a consumer can know which are good or which are not good. So 4 years ago, we started CyberGuide, PSYBERGUID. And if you go to onemind.org, our website, you can see CyberGuide, and you can see our rating of more than 400 of these apps for their efficacy and their specific disease applicability. But to make this easier, we've actually worked with a major organization in the US called the Northeast Business Group at Health. And I'm going to turn this over to Katie in a minute. She's going to talk to you about what we're doing there. But taking advantage of digital health and telehealth are an important thing that we as a country can do. We can pass legislation to make the availability and accessibility of telehealth more active, and we can put back in place training for more psychiatrists and people to support the increase in the workforce that we need. And then I guess just the important thing around the issues of awareness and the reduction of stigma are things that we can do. This Ken Burns project that I mentioned to you is going to happen, and it will include curriculum for every public school teacher in the United States, but that's not going to come for another year. At the end of this month, we're going to be with NAMI doing a major telecast, not telecast, but a series of 3-day programming on all social media platforms, Instagram, Facebook, and YouTube, with a huge number of celebrities and public figures that for 6 hours a day, we're going to be doing. I think many of you may have saw the Lady Gaga telecast. It was in response to COVID-19, but it wasn't specific to any disease. This is going to be all about mental health, all about youth mental health, and its impact on anxiety and depression. So we've got superstars performing songs. We've got scientists talking. Brandon's going to be interviewed. And on Wednesday on the Today Show, we're going to announce this show. But look for the code words "Stronger Every Day." Stronger Every Day is going to be the title of this telecast, and you'll start to see announcements, web links, Spotify, Pandora. Others will be curating actual music lists by these artists. So we think we're going to reach 12 to 18 million people at least by these telecasts, and that's, we think, going to help both raise awareness and to get this whole idea that no one's done anything wrong. There is no shame. There is no blame. We can all get help. Katie, let me turn it over to you to talk some more about what our employers are doing and some of the specific things that are available. Katie Riddick is a colleague of mine. She is leads many of our efforts, and she's leading this particular effort and some of the others. I'll just ask her to spend a few minutes. Katie, turning it over to you.
Hi, everyone. Thanks so much for having me, and delighted to support Garen here and build on his comments. Seeing lots of great questions come in on the chat, and I want to just address Nalini's question as well as some of these with regard to employers and how, in particular, employers can be preparing for some of this mental health fallout. So one of the questions was about when we can expect to see the effects of this. I think we're already seeing it in the front line, but there are lots of fields that are starting to return to work. There's some considerations in addition to the ones Garen mentioned about the stress and anxiety of the current situation, how things have changed for people, the economic impacts that I think are causing a lot of stress for folks as they're uncertain about their job future or their industry. There are also concerns about returning to work and the stress caused by reintegration into society if you are at risk or you live with someone at risk. So I think quite a few employers are looking very carefully at their planning for how they return to work, whether that's a phased approach or changing the physical spaces in which they have workers interact with each other. I think is an incredibly important consideration that many employers are taking in right now. The other factor that is driving some challenges in the mental health landscape are that people who have been living with mental health challenges for some time may have had a disruption to their ability to manage those conditions. So they may be having trouble seeing their provider or using other support structures that they've relied upon to help manage a mental health challenge. So as we are seeing things start to reopen, as we are seeing better access to mental health, there may be some transition for people who live with a mental health challenge on a day-to-day basis, returning to those kind of stabilizing practices that help them be productive and be contributory to their workplace. So I think as we have talked to our employers who are members of One Mind at Work, they're spreading messages of empathy and understanding, having managers really take into consideration both their own mental health and those of the people that they manage, because both are critically important as you are trying to return to an operational status. And then the other factor is we know, employers know, that the use of available support and services available through EAPs and through health insurers and other types of those kinds of paid vendor support programs are often underutilized. And so one of the most important steps that employers are taking are proactively communicating the available support and services. As Garen mentioned, there are gaps in availability. That's a bigger problem that needs to be addressed. But oftentimes, employees may not be aware of what all the support is available to them, and so it's critically important that the leadership team is communicating, the HR team is communicating, and the frontline manager teams are communicating out to their staff to help everyone be aware of what's available so that they can make use of it when they feel it's a time to do so. One of the biggest challenges is to access the appropriate support you may need when you're in crisis. So expecting people to be able to navigate a difficult system or seek out those services themselves can be particularly challenging. We want to see and we hope to see employers use this opportunity to make that pathway easier so that people are able to access the support and really utilize all the available tools for their mental health.
Great, good. Thank you. We've had a number of questions, and so we'll start with one of them right away, and then the others I really would like you to just ask the question, please. But there's been a question about frontline health workers and doctors and nurses and the impact of COVID on their mental health, particularly because they're usually the last ones to see people, before they go into the ICU or before they get on the ventilator. The mental health impact is huge when someone says, please save me, please save me. So really, I wanted to understand that. Today is apparently International Nurses Day, so it's good to talk about this, but I think Judy asked that question, but somebody, so go ahead, please, Garen.
Well, even before this crisis, healthcare workers have a disproportionate rate of anxiety and depression. We are fortunate to have within the members of this global coalition employers, Kaiser, Sutter Health, Aetna, Optum, United Healthcare. They all tell us that the incident rate of depression and anxiety in their workforce is 40%. 40% of their workforce had that before we introduced this trauma. So they're already starting from a very high base, and I'm also unfortunately need to tell you that the suicide rate among this population is also higher than other populations because they are just so stressed by the fact that their job and their oath of trying to heal people is challenged because they can't do it in every case. And in some cases, that is just too much for people. So we just saw that last week with a doctor who was a COVID-19 doctor who took her own life and caused the significant awareness of all this. So yes, the answer is it's very difficult and it's gotten worse. And yes, because their hours are so now impacted, they don't have time to take care of themselves. So we are launching to address this problem in connection with a major technology company. I can't announce the name yet, but I will be able to do it shortly. A program that's launching at the University of North Carolina that is called Heroes Health, and it's an app on the smartphones of frontline workers that's going to allow them to answer a set of few simple questions each and every day, so we can start to track the baseline of their mental health, and using some very sophisticated analytics and then some telehealth and other services, intervene with them and help them try to cope with and make others aware of their condition, so they don't suffer in silence and they don't get themselves into a position where their only outcome is to not live life the way it is because it's so bad the way it is. So we're launching that on May 15th, Heroes Health. Stay tuned. Once we get through the beta phase, we expect it to go immediately to Duke University, which is right there. We're then going to move it to hospitals in the Boston area, and then we have hospitals in the Los Angeles and San Francisco area. And if this continues to be successful, we hope to make this available for free to all healthcare systems in the United States, so that we can make services that exist available and new services that aren't available to frontline healthcare workers, because we must help them through this difficult time.
Great, great, great. Thank you. That is, we'll watch for that. Is there any other questions that people would like to ask? Gloria, you have one.
Oh, Millie, I'm not good with my mute button. Can you hear me?
Yes, can hear you.
Okay, hi. First of all, thank you for this discussion. It's so incredibly important right now, and really appreciate it. My question wasn't so much about people in the workforce yet. I was wondering if you're looking at all at graduating college seniors right now who are very anxious about not only joining the workforce, but really anxious about what are they getting into, now that they're leaving college. I was interested in if you're looking at high school seniors as well, but especially college seniors, because I know that it's very difficult for them right now.
We have been actually looking at this well before this COVID-19 happened. We have been working, UCLA as a test case has actually built an anxiety and depression assessment tool that every incoming student at UCLA can take to measure where they are in a scale of 1 to 5 in their anxiety and depression. And I can tell you that north of 40% of every incoming freshman reports some level of depression and anxiety. At UCLA, that number is 7,000 incoming freshmen. So we're looking at a number north of 3,000 of them that have some level. And I can tell you that before we started the assessment, we needed to have a system of care. So we embedded within at the very extreme level, there is suicide-related hotline services, and 100 of those 300 people needed those services. But at the more milder levels, we've actually trained peer group counselors to address this issue, because sometimes people just need somebody to talk to deal with this, and to have a voice that they can know that it's not abnormal for them to feel not normal. So we're hoping to take this UCLA program and expand it throughout the Los Angeles area. We are talking to the commissioner of the Big 10, Big 12 schools. We're talking to Susan Arnold, who's the head of the AAU, because UCLA's data is replicated throughout the United States. They just have more precise data, but it's 100% certain of that. But Gloria, you also raise another point, and our employers tell us the same thing, because they leave school with this same level of anxiety and depression. Am I going to get a job? Will I be as successful as my parents? Where am I going to live? How am I going to repay my student loan? They come to the workforce with that same level of anxiety, and they're looking for services. They want people to help them cope with it. So the whole Gen Z phenomenon and their issues are now a whole new component of workplace mental health that employers are needing to come to. So you're right to point up this issue. It's very important, and we're just early developing assessment capabilities. I think can do a checkup from the neck up themselves, right, and see how am I doing, and then have access to resources, maybe through our cyber guide services or others. Katie, do you want to say anything about that?
Sure. There's an RFP out from the Wellcome Trust that may be of interest to some on this call, looking specifically at depression interventions for young people as well. I'd be happy to share that after the call, but I think quite a few research funders are looking at the opportunity to study particularly the impacts of COVID, but as it relates to the stress that they're already identifying within those emerging generations that you've identified here, Gen Z in particular, as they're entering the workforce.
Thank you so much.
So there are a couple other questions that have come up. Dr. Huma Nawaz, you've been asking a few questions. Do you want to bring one up? Dr. Huma? No? Okay. I'll find her questions, but is there someone else who would like to ask a question?
Yes.
Go ahead.
Yeah, I would. So this is Dr. Judy Kuryansky. Garen, it was nice to meet you at the United Nations at the Group of Friends meeting when you presented to the countries at the UN about workplace issues and mental health. Do you remember that?
I do, Judy. Thank you for reminding me of that. We were there with a number of countries, and that was when Patricio was there, also
yes,
representing the World Bank.
Marquez was there from the World Bank, and Ecuador and Belgium. Well, I started that group years ago
Yes.
during the Sustainable Development Goals. But so my question relates to that. In the sense that, being that I'm connected to so many different countries around the world and talking about projects now with Costa Rica and mixing the missions and the departments of health, how open are you with all the wonderful projects that you're doing with regard to the apps and the healthcare workers and so many different projects, to expanding this as a pilot to other countries? Because right now, so many countries, Italy, Costa Rica, Argentina, Russian Federation, we're all talking together and really trying to get a unified project. So are you open to that kind of thing and piloting in other countries?
Well, we chose the name One Mind, Judy, for a very specific reason, because we didn't want this to be the American brain society. You know, we have American Cancer, American Heart. Our efforts need to be global because, as I said earlier in my comments, these diseases are global. So we can't just fix them here in the US, and we need to work globally. So the answer to that is absolutely, we're open to doing that. We have collaborations already with work in the UK, the Wellcome Trust, which Katie mentioned. For those of you on the call who don't know that, it's a $15 billion organization, and they have their three focus areas are climate change, mental health, and hunger. So we are one of their three focus areas, and we're working very closely with them. There's a very, very big project, Judy, that has moved forward since our meeting, called the Healthy Brains Global Initiative. And this is now a collaboration of over 60 global leaders, now formally endorsed by Tedros at the World Health Organization, the World Bank, and the Future of Health and Healthcare Forum, the UNICEF, as well as the Wellcome Trust, to bring together a 20-year plan of implementation science, translational science, and basic science. And we expect to launch the funding of this and the formation of this Healthy Brains Global in the spring of next year. We are moving towards raising $10 billion to fund that initiative. And the kinds of programs that we're talking about right now are a part of this implementation science effort that we will be putting forward. I think you probably know Judy Shekhar Saxena, who headed mental health for the World Health Organization, who's now at Harvard with Vikram Patel.
Right.
Both of them are members of this task force and are going to be helping us with these early projects. Another one, which I believe you're familiar with, is Fountain House and Clubhouse International, who have services that are available for integrating people back into society, ensuring compliance with medication, but giving them workplace training, positive skill-based training to get them to be able to integrate back in society. We're hoping to develop, and they're working on telehealth related services that they can bring to remote areas of the world. So when it comes to mental health, brain health, Shekhar has this phrase of saying that the entire world is the developing world. And I think I have to agree with him. But Judy, I'd love to work with you more on how we might accelerate the deployment of the ideas that I've shared with you today in these other countries.
Okay, thank you so much. We'll be in touch.
Yeah, great. Any other questions from the audience? We have a few more minutes. I know Garen has a hard stop, so we will wrap up 5 minutes before the hour is up. But any other questions from people?
This is Elizabeth.
Go ahead, anyone? No. Okay. So I wanted to unpack this workplace thing a little more, Garen, and talk a bit about the impact on women. Today, there was an Fortune article from Sheryl Sandberg that says that women are doing double duties, not just balancing work and home, but also balancing now schooling, homeschooling, and elder care. So it's really a lot, and women are burning out more. And employers, do they have a responsibility to do something additional for their women employees? So just wanted your thought on that.
Very, very important issue. At last year's Global Leadership Summit, every year we bring top leaders in workplace mental health together. We were fortunate to bring the editor of Women's Day magazine there to report on a survey that we did. There are 20 million subscribers to Women's Day magazine, and they did a comprehensive sampling of their readers about what was the attitude of women and in particular workplace mental health. And Katie, could I ask you to share some of those findings?
Sure.
And then I'll come back and tell you about one of our employers, the Bank of America, that I think is doing one of the best responses to how to deal with these issues today. But let me talk about this survey. We'll let Katie talk to you about that.
Sure. So from the survey, which was of a cohort of several thousand working age women, we found essentially what we'd expect and what Garen said before, which was everybody knows somebody or they themselves are struggling with a mental health challenge. The interesting findings were that people were not totally comfortable disclosing when it was, especially when it was them, but also when they were caring for somebody who had a mental health challenge, which we all know women are often in those caregiver roles when there's a situation. In addition to being caregivers for children or potentially, older people in their families as well. And then one of the most interesting findings was where women were looking for support, and it wasn't the usual channels. So it really reinforced that employers need to make available resources and available support open and easy to access, because women weren't going to their HR department, for instance, to find out what resources they could get help with caregiving responsibilities or other, flexible work arrangements or whatever it is that they may need that might make that responsibility just a little bit more manageable. They were looking to their colleagues or to their frontline managers for solutions, and if they didn't know, then those women might be missing those opportunities. So it was really a conversation about, or an illuminating piece of evidence about how women are managing some of these stressors, and then where they're looking for help, and showing that they still, even though we've made lots of progress about talking about mental health challenges, may not be sharing exactly what is driving their stress or anxiety or the pressure on them with the people who may be able to help them manage some of those needs. So really interesting data to come out of that, and still a lot of work to be done in terms of supporting women.
That's okay, Katie. That's available on our website or also on Women's Day magazine. So again, you can go to onemindAtWork.org and you can see that survey data. But let me just talk about Bank of America, and I know there are others. So to address what Sandberg was saying, there's some pretty obvious things that should be done. First, the way you deal with the uncertainty is you guarantee that there will be no layoffs in your organization. Bank of America has done that. They will said that no one during this crisis will be laid off. In fact, they've hired 3,000 more people. Second thing that they've done is that they have guaranteed and pay for daycare for every one of their family members. They made that a mandated benefit within their organization. They're not the only company to do that, but that is certainly something that is necessary for people, particularly as they consider coming back to work, because the summer is not going to be the same, right? Kids don't go to summer camp this summer. They're going to be there. And who knows what the fall and what school is going to look like, and whether they're going to be there all the time, part-time, still more learning. So guaranteeing economic certainty and providing the additional benefits of daycare support, and then ramping up the availability of telehealth services has all been a part of a comprehensive package, which they are doing. Other employers I know are also adapting one other thing, which is that when they go back to work, they are leaving it to the employee to decide whether or not they want to come back to work. And they are not going to mandate that you be in the office just because others are going. One of the questions from Judy that you asked, and I think I see it embedded in some of the other questions, are we moving too quickly? Well, I think Dr. Fauci was on congressionally testifying, and he gave the medical opinion to that point, which is, yes, we are at risk here by coming back too early. But as it relates to the mental health risks, I think it's an individual decision. I think everyone's going to have their own comfort level, and we need to be able to give people the freedom to exercise that comfort level so that when they're ready, that they can come back. And certainly as we get higher levels of testing, they were today talking about the ability to do 40 million tests a month, but that's September. It's not now. And we're talking about vaccine availability next year, maybe in the fall, and this one that's based on genetics. But we're a long way from the world being the way it was, and it probably will never be the way it was. So we need to address these anxieties and this level of uncertainty leading to the depression that it causes. So I want all of you to remember there should be no shame, there should be no blame. The new normal is to recognize that everybody has somebody, and don't be afraid to talk about it. Don't be afraid to address it. Be open, be direct, and make sure that in your own workplaces and work on there, you don't perpetuate any discrimination or stigma of people with these illnesses.
Great. On that note, we'll bring this discussion to an end. I really have enjoyed this dialogue very much. What is amazing to me, Garen, is you have filled us with hope. You know, it may be a huge problem. It's a huge problem the world never anticipated and very quickly was plunged into. But hey, with everything that you're doing and what others are doing, and a global movement being built, and a cyber guide that ranks applications, and you know, the focus on women and on workplace mental health. This has been incredible. I really, you know, want to congratulate you and wish you the best, really, all of you at One Mind, for what you're doing. You're doing God's work. Keep it up. From our side, we will wrap up. We'll have some learnings, key learnings for you, and we'll share that. We have recorded this session. We'll share that. And half the people who registered weren't able to join, so we'll make it available to everybody. And I also wanted to say that our next webinar, we have a Weight Watchers chef, a former Weight Watchers chef, talking about cooking, healthy cooking at home, and including reducing salt, which is one of the big problems Indian Americans and Indians face. We can't cut our salt very easily, and that's very important. And after that is June 6th is diabetes and COVID. Why do people with diabetes have higher risk for COVID and COVID complications? So to unpack all that, we have, you know, the next two webinars. We will be addressing women and COVID in some way. We also want to have a mothers and daughters kind of session. And we'll do this at least once a month going forward the rest of this year. But thank you for, you know, helping us kick this off. It's been a very, very interesting and important discussion. Thank you. Thank you all for joining.